Hello, I'm Deborah Chieli, a nationally board certified nurse practitioner with specialty certification in lifestyle medicine.
And I'm Susie Spell, a nationally board certified nurse practitioner, also certified in lifestyle medicine.
The following interview was part of a series that informed our presentation at the 2023 Annual Conference of the American College of Lifestyle Medicine, ACLM, titled Nurses in Action, How Nurses Operationalize Lifestyle Medicine in Modern Settings, and You Can Too.
In this series, nurses from diverse backgrounds and practice settings and their champions tell their personal and professional stories about discovering lifestyle medicine and how they're implementing it across a wide range of settings.
Nurses are the largest health profession in the United States and globally, and have been voted the most trusted profession here in the U.S. for over 20 years. Learning about and incorporating the pillars of lifestyle medicine fosters full scope of practice and the ability to answer the call to lead by the National Academy of Medicine with their report, Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity.
We hope these stories of success will inspire conversation and drive creative solutions to better address inequities in healthcare. Continued growth of nursing expertise in lifestyle medicine will expedite our nation's ability to address the public health emergency of chronic lifestyle diseases we currently face.
The power of nurses to create innovative solutions when combined with the practice of lifestyle medicine allows nurses to express their full potential while simultaneously addressing the salient issues of health equity, the epidemic of chronic disease, and the provision of truly patient-centered whole-person care.
When nurses are empowered to lead with an interdisciplinary and multi-sector practice, they answer the call of the National Academy of Medicine to dissolve barriers to care and improve health for themselves, the nation, and every global citizen. Enjoy the interview. Welcome, everybody. Today, we're talking with Nikki Liversedge. She is a registered nurse case manager for the Alzheimer's trial at the Preventive Medicine Research Institute in Northern California, where she's part of a team of leading medical professionals in conducting research on the power of lifestyle as medicine. She has 17 years emergency department experience as a registered nurse, and she completed her health coaching certification through the Institute for Integrative Nutrition. She's passionate about health and being, as well as reversing chronic disease. And not only does she understand just how powerful lifestyle changes can be, but she educates and supports others in their journey to do the same. And some of her recent work includes assisting with development and coordination of a family cooking program. And some of her own interests include running, training for marathons, and cooking healthy meals. So welcome, Nikki. Thank you so much for spending this time with us.
Thank you.
You're welcome. So we have a number of questions for you. We want to hear all of what you've been up to. We are really looking to highlight what registered nurses and nurse practitioners and even nurse educators and everybody else in nursing, how they're implementing lifestyle medicine. So what I think we should maybe ask first would be if you could provide us with an overall view of your current role and what you're doing now.
Sure. Yes. Currently, I am a team member and nurse case manager at Preventive Medicine Research Institute, where I case manage a group of cohorts that are enrolled in the clinical trial. And I work at Preventive Medicine Research Institute. And currently, I'm not full-time anymore. I'm just helping ad hoc since the study is coming to an end. But I've been case managing groups, cohorts in the study for the last year and a half. And anything to collecting medical records, to helping with adherence, to meeting with them, coaching as they're making lifestyle changes as well. So that was a big part of my job for as long as the trial went on. So 20, 40 weeks, etc.
And so when you said a number of things that you did. Adherence was one. Mm-hmm. So what were you doing to help them with adherence? What were they adhering to?
This is a 4-modality study where they had diet, stress management, exercise, things like that. And so I was helping them adhere to those study guidelines as far as the parameters go, which I have to say, I probably can't give super much detail on it just because the study is ongoing still. So just to throw
That's
that
totally fine. Totally fine.
Yeah.
But you use some of your like coaching skills in that, right? To get them to be
Yeah.
able to follow through with whatever those study recommendations are, which have to do with lifestyle, right?
Yes, lots of coaching, lots of motivational interviewing, their why they were doing it. They were completely volunteer at this point, so that could be a challenge too, because having to get their buy-in and keep their buy-in was it's always a goal.
Yes. Yes, I understand that. And so let's turn the dial back a little bit from your current role.
Yeah.
And I want to ask you about how you discovered lifestyle medicine, or was there an incident that happened, an experience, something that got you on this trajectory, or it was just a way you lived and you wanted to help your patients? How did that happen?
Yeah, so good question. I actually remember this like it was yesterday. So I had been in emergency medicine my whole nursing career. And I got to a point, probably, I would say maybe 15 years into my nursing career, and thought, gosh, there's got to be a way that I can help people prevent them from coming in the emergency department with some of these continuing chronic issues that they're having or acute on chronic illness, etc. I remember I was spending some time with a patient in the room, and I like to talk to my patients while I was starting IVs and doing things and get to know them a little bit more. And I remember using the whiteboard in her room, and I figured out the amount of sugar she was consuming in a day and the calories, etc. And she just looked at it like, oh my gosh, no one has ever talked to me that way. No one's ever, this is the emergency department. Like, who goes into these details of explaining those things? So from there, I use those little techniques with a lot of my patients and would just ask them, like, would you like to know a little bit more about diet or exercise or lifestyle? And so I was just introducing those, but it was funny because I didn't know that lifestyle medicine even existed at that point. I didn't know that lifestyle medicine was called lifestyle medicine until I just went on my own journey of research on there's got to be a name for this. What is this? I know what I want to do. And then I came across the lifestyle medicine program at Corewell Health now and just went down that journey and I got a job with them and ended up leaving emergency medicine after about 18 years in the emergency department. So that's where my journey started. And that was only about 6 years ago. Yeah, so I'm kind of new to this.
So let me ask you a question though. Like you did that for that woman, which I'm sure was incredibly powerful. I have two questions really. Mm-hmm. What made you even want to do that in the first place? Because I remember I worked ICU. So I remember being super busy. I was not thinking about that. So what made you interested in that nutrition piece and its connection with health? I guess that would be the first question. And then the follow-up question is, did your colleagues think you were crazy? Were they like, what are you doing in there?
Yeah. So what actually prompted me is when I was talking to her, she was talking about weight. She was in her 30s. She was mentioning how she had gained a bunch of weight and she had some stomach issues and things like that. And so I just asked her a question about her diet. I said, what kinds of things do you eat and drink? And she had shared that she drank a lot of soda. And so I said, do you mind if I just share a little something with you? And anyway, that's what prompted that. Just simply asking the question and seeming interested in getting a little bit more information, which doesn't seem typical of an ER who has time to really ask, what do you eat and drink for the day? But I found it was a little ticket into seeing if I could help her discover maybe some other issues. And the second question, did my coworkers think I'm crazy? I think they did at first, but then they kept coming to me and asking for me for information. So you could ask all of them. I lead by example, bringing in treats that I've made that are healthy and even to potentially coaching a couple of them here and there. So
that's amazing.
Yeah.
I love that. I love that story. And because as I'm well aware, as you are, and Deborah, I'm sure, sometimes the break room in our hospitals and institutions don't have the healthy treats exactly.
Yeah. Yeah.
So how do you think you pull this information? So we heard how you were able to apply it in an acute emergency room setting. And then now you're doing the research with the Preventive Medicine Research Institute, right? But is there any other ways that you incorporate this into your nursing practice?
I live it and breathe it myself on a routine basis. So that's one way. I attend webinars and seminars through ACLM to get on the latest research. As far as outside of that, experiment with my family and my friends and educate the patients that I lead in the cohorts when I can. At this point, I would love to, in the future, have another opportunity in a job where I can utilize lifestyle medicine. And that's kind of where I've been looking. I think all areas of medicine could use a lifestyle medicine colleague.
Yes, we definitely agree with that. What have you found to be the best ways to educate and empower patients about lifestyle medicine? Is there anything specifically in terms of tools or strategies that you have found the most helpful?
I guess one of the biggest things is using some of those coaching techniques that I've had over the years with motivational interviewing, really getting behind someone's why, I think is super important and leveraging off of that. And then ACLM has an enormous amount of tools. We used it in the Corewell Family Kitchen program, pulled off a lot of information for participants then. And yeah, I would say those are the big things.
Yeah, that's great. Yeah, and ACLM has so many things now.
So I have to admit, it's a little overwhelming, the information. I'm on like information overload. I feel like I can't get enough in a day.
I know. And even in the few years that I've been affiliated with them, it's the amount of information and assets that have grown have been just exponential, and it is amazing. So I love that you said that. And of course, being a model, right? Being a model and walking the talk. What do you think some of the biggest barriers or obstacles are in terms of using or implementing lifestyle medicine in any setting, really? Because you have across the board kind of settings.
I think coming from the emergency room standpoint, I think there's really a lack of education and knowledge about lifestyle medicine. I didn't know that even existed. When you get into your own area of whether it's floor nursing or ICU or any of that, you don't know. You don't know anything about it. Nobody talks about it. So I think that's the biggest thing is lack of knowledge and education behind it. I have actually, it's been really cool to see how it's grown over the last couple of years, even more so in the last 6 months, just like with my journey of looking for what's next. So I think it's more and more people are learning about it. But I think getting people in there to actually educate on it, people in lifestyle medicine, would be really helpful. Another thing I think maybe is a barrier is everybody has their way, right? Their certain way, and change is a little bit difficult. So maybe some reluctancy to change, or maybe not support from leadership with that change either could possibly be a reason. And also maybe because people don't know where to start, integrate it in their practices, or in who would think you could integrate lifestyle medicine and emergency medicine. But I think those are some of the barriers that I would share.
Yes, those are great. They're not great barriers, but great explanation. Great explanation.
Yeah.
Is there any certain patient experience you could tell us about that was a success story?
I guess I would just go back to that emergency department patient. For one, I think that really opened her eyes. And working with the Family Kitchen program at Corewell Health, it was really great to see these families that might not have had the means to do something like this, but it was fully supported by a grant. And they went through this 5-week program with getting food and doing this cooking program. So I just seeing those families was very successful. They made it through the 5 weeks, which is a big time commitment, and you're cooking virtually because of COVID, so it's on Zoom. And outside of that, I haven't really gotten into my element of individual lifestyle medicine with people yet, but I'm working toward that.
Yeah, that's great. Will you tell me again the name of the place where you were doing the cooking? You said Cornwell or Corwell?
Corewell. Spectrum Health used to be Spectrum Health.
Oh, okay.
Yeah, now it's Corewell. Yeah, Corewell.
Okay.
Yeah.
Okay, good. All right. How have you collaborated with other professionals? I'm guessing, with the role that you're in now,
Yeah, right.
you guys have,
We
I
have a
think it's
team.
4 pillars, right? Because
Yep.
this
Yep.
is the program you're affiliated with is it Dean Ornish's program of the pillar? Okay. And so you have a different professionals for each of those pillars?
Yes. Yep. Registered dietitian, nurse, and we have who supports stress management as well. Those are the
Do you do anything? I'm just curious. Like if you
yeah,
get
yeah.
together and do like team meetings, or how does that work? I have a friend who was a dietitian for one of the Ornish programs here in my town
Oh,
in Florida.
mhm.
And so they used to come together pre-pandemic
With
and
retreat.
all right and get together.
Yeah.
So
They
virtually.
don't do that anymore, unfortunately. Yeah, we have a team meeting, yeah, virtually on Zoom. So,
Mhm.
little story with that is I've only met one of my team members in person, and I've worked with them for a year and gosh, 8 months now or something. So crazy about that. So I'm hoping to meet them all one day.
All right. Yeah, and it feels like you know them. We've all
Oh
got used to the Zoom thing, I think.
yeah, yeah. No,
Yeah.
I do. This has been my yellow wall for the last year and a half. A little
Right.
boring. Yeah, but and then the other thing too, I've been doing a lot of maybe it was not my team, but I've been trying to connect outside of my network as with ACLM members. I'm sure I've sent you guys a couple of messages just connecting, trying to connect with the nurses involved in ACLM, and I've even talked to some physicians in different states that are integrating lifestyle medicine too. So just started my own boots on the ground effort on trailblazing nursing and lifestyle medicine.
Yes, I hear you.
Yes, I think
I'm sorry.
I connected you through Alataya also there.
Yeah.
We
Mhm.
were going to have that buddy thing. That was one of the things that I was really excited about is that because at Rochester Lifestyle Medicine Institute at the jump starts, people can buddy up if they want to. So we were brainstorming and I was supporting Lataya. I asked her to volunteer, but I said, I'll help to lead up the network, the mentorship. And that was one of the ideas. So I connected you over with Lataya there. And I know that she followed up with you also, but yeah, I know we paused here, but I want to really applaud you for just being willing to have the courage to go outside and of this world. You said when we get into our spaces, into our areas, I just had this picture of we just go into this nursing station or this unit or that unit, 6 West, ICU, ED, and then you're in this pocket and it's just what swirls around there, but you're reaching out beyond your team there and the teams that you've met, including the family kitchen, but also beyond your license to physicians and others. And I love the word that you use of trailblazing. That's what we're hoping to do here is really build some trailblazing paths, carve some trailblazing paths for nurses. And you'll be a trailblazer for yourself and for others with what you share here. And we'll love to talk. And Susie, we have a series of questions, and Susie, I'm interrupting this here, but really that we can learn from one another so much, and we don't each have to reinvent the wheel or do this whole discovery process.
Mhm.
We can build it and then everybody can come and then we can build more and then others can share and say, oh, this is what I found. And we can explode it out eventually, which is really exciting. And I'll just, while we're sharing, I just wanted to say one thing that caught me was when you talked about sometimes it's like a wording, you captured it as a ticket. You said that with the emergency room, when she said she's gaining weight and that patient there, and that you've started asking. And sometimes it's like that ticket, that entree in. And sometimes when we can capture those words for our colleagues too, they can think of that too. What's my ticket in for this patient or for that congregation or for that community or whatever the population is? What's the ticket in? I love that. I thought that was really
Oh, thank
powerful.
you. Thank you. I appreciate that. It's interesting because it's a it's definitely a challenge putting yourself out there and outside your comfort zones. But I found if it's something you're super passionate about and it's like a life journey, then it makes it easier. I was talking to one of the nurses that I work with currently, and she's, oh my gosh, you're connecting with all these people. I wouldn't even think about doing that. I was like, oh yeah. And if they don't respond, I send them another message. But
Mhm.
it is, and I hope this makes it easy for people because it's a weird time, right, for all of this, and especially I feel with nurses because some of those positions are being filled by health coaches, but I really feel like nurses are very instrumental and they are coaches in a particular way. Yeah, I don't want to see us get separated out. So,
Mm, that's a really good point. We are already educators. We are already coaches. We can add to those skills, but we
mhm.
should never think that we have to do that in order to practice basic nursing, whole person education of our patient. Our code says our patients should have the right to be informed, to make informed decisions. That's right in our code. So we're empowered to do that. And I love that you captured it that way. We can get those extra credentials of health coach or culinary or whatever. But ultimately, I think part of our passion here for Susie and I is we have the luxury of being providers, but nurses are everywhere, and it's the science and the art, and it's the whole person approach. And so, yes, that's a coach, right? Meet
Yeah,
people where they are and then go on that journey with them and support them in that. And yeah.
yeah, I agree 100%. I love that.
All good commentary. I love it.
Yeah.
I do want to ask you, which I have an inkling of the answer, but how do you stay up to date with the evidence base when it comes to lifestyle medicine?
Gosh, it probably has nothing to do with my ACLM membership. I'm not sponsored by that, but truly, that's where it all comes from. Being on the member interest groups, you get all that information there. Emails on these webinars. I've attended these free webinars that have been sent out, which have been fantastic. I also get a lot of up to date things from Dr. Ornish, working with him as well. Again, I so much research to try to keep up with, but I try to read it as things come up and what's relevant at the time. But yeah, there's a lot of information out there. And of
Right.
course, social media. There's people on social media or physicians that are renowned physicians and
Right.
respected. Yeah.
I love that. And of course, that's been instrumental for us as well in our journeys. What about any specific recommendations that you have for other nurses who are first hearing about lifestyle medicine or interested in finding out more about it or incorporating it into their practice?
Yeah. So I saw that question and I think I just put, just do it. Just go forward with it. Just take that extra leap. I think that there's no harm in getting some questions answered about it. So I say reach out to ACLM, the website, and actually the free CEUs. That's amazing. That is huge. And I also think too, it would be really cool if maybe if there were people that were lifestyle medicine nurses, maybe just having them reach out to the lifestyle medicine nurses already and maybe their organization or facility or things like that too to get more information.
Yes. And I love that you mentioned all those things, but the one that you mentioned, I'm guessing that you're meaning the 5.5 hours of free continuing ed about lifestyle medicine. That's what you were
Yeah,
referencing right then, right?
thank you.
Okay. Yeah,
Yeah,
that's great.
yeah.
What do you think, or what do you believe is the future of lifestyle medicine within the context of nursing
Mhm.
specifically? And maybe how would you envision it evolving over the next, I don't know, 10 or 20 years?
Yeah. Gosh, that's a big question. I had to think about this a little bit, but what my hope is that eventually there will be lifestyle medicine nurses in all areas of the organizations. I think it would be really cool if there were actually lifestyle medicine facilities that were just lifestyle medicine in itself with lifestyle medicine nurses as well. So that's long term down the road at all. But I really think that I think there are more nurses out there that really want to learn more about lifestyle. I just think capturing them, getting them, educating them, getting them excited that there are these possibilities I think it's gonna really boom over the next few years. Um,
Yes, I agree. I feel like it's a snowball like rolling down the hill. It
yeah,
just keeps getting faster and bigger and faster and bigger, which is really
yeah.
cool.
It's so cool. Yeah. And even I love the people I work with because, of course, they live and breathe lifestyle medicine. But honestly, when I talk to other people or other nurses, like the nurses that I used to work with in the emergency department that are not lifestyle medicine and that don't focus on that, they have a very eager interest in learning about it as well. But it's interesting because sometimes the department isn't set up for necessarily for that and spending additional time and talking about it, etc. So I think it's going to be really cool when there's lifestyle medicine nurses scattered throughout the whole organization. So
Yes, I think so too. And it's also a way that we can up level our own health.
yeah,
I found that to be true for myself. And as Deborah is much more familiar with and skilled with the future of nursing, the National Plan to 2030 really does call for nurses to be able to take care of themselves in a nice way, which lifestyle medicine, we can do that through that for our own personal health as well, I
yeah.
think.
I'm gonna comment off of that, which I think is great. Wouldn't it be cool to have lifestyle medicine nursing retreats? I don't know
Yes, that would
what it
be
looks
super
like,
cool.
but
Yeah,
that would be fun. And then get other nurses, maybe who are not lifestyle medicine, have your lifestyle medicine champion nurses and bring these other nurses in.
that'd be amazing.
Yeah.
You can add that to your list of ongoing initiatives.
And if you're looking for a volunteer to help with it, I can do
Right. Yes. Yeah.
that.
Any other projects you have going on or initiatives when it comes to lifestyle medicine at the moment?
Yeah, so the biggest thing is I'm studying for my ACLM certification. So I'm super nervous about that. I feel like I'm taking the nursing boards all over again. But I finished the third edition. I purchased the third edition and I'm working on the fourth edition currently. So just working through that. That's the biggest thing right now. That's I can focus on that and work.
And it is a commendable thing to be able to do that because it is a lot of study. It's a lot of study, a lot of learning that
Mhm.
goes into that. I know you'll be fine, you'll do well. It is a lot to study, but it is really empowering. So I wish you the best of luck with that. And Deborah also has other initiatives she's working on that helps people with their mindset and strategies for going
Mhm.
towards the boards too. She could inform you a little bit about that too. But what
Mhm.
about, is there any way that you guys use right now, maybe in your research, anything that you use to measure the impact of lifestyle medicine interventions? Is there anything either subjective or objective measures? And I
Mhm.
know with this study, of course, they'll have to analyze the data and put
Yeah.
that out eventually, right? Uh, but anything you can comment on there?
Yeah, this is on public domain on Preventive Medicine Research Institute, but the primary endpoint measurement is cognitive tests eventually. So that's cognitive function tests. But again, that will be later established. So nothing in the nothing other during the process.
Do you guys measure things like or track like weight and blood pressure and those kind of things? Or this particular study is only the cognitive piece?
Are we on or off the record?
Oh, maybe I shouldn't ask. Okay, we can scratch that one.
Okay.
We can scratch that one.
Okay.
I would say, let me turn it over to Deborah for a second.
Okay.
Deborah, do you want to comment at all? Anything more about future of nursing or anything in regards to that we can wrap up?
A couple of things, Nikki, is that you commented that colleagues say there's no time and how do you fit that in, and that you managed to. And one of the ways was that there's an opportunity in that ticket in, and it didn't take that much, a little whiteboard and throwing up some numbers of sugar and oh my gosh. And those kind of light bulb moments that we can help our patients see, because it's similar and parallel to what you said about your colleagues and work setting is we get into our little world, we get into our zone, whatever the unit is, the floor is, the institution is, the healthcare center, and the same for our patients and our communities. And what seems normal it may be very unhealthy or abnormal, but it seems perfectly normal. And I love the parallel there, as you described, where we get in there and we don't know anything about that. And then you took the example of your patient. And I think one of the ways that people learn, and we can share with our colleagues and with our patients and with those that we are trying to raise this up the flagpole at higher levels in an organization, are stories and their analogies, like those kinds of analogies. And I think that the way you picture that is really helpful for sharing with nurses. So a follow-up to that is, are there ways that you found are effective to expand this with your peers, your colleagues, nurses, or otherwise? Besides, I know you had described my experiment with my family and